Meharry Medical College also. Upon graduating from Meharry, I did a residency in general surgery at Howard University Hospital in Washington, D.C., where I trained under Dr. Clive Callender, who Dr. Faulkner spoke of. Dr. Callender is also a graduate of Meharry, and while at Howard, I worked with him on the transplant service and really became interested in it then, and told him at that time when I was a resident that I would like to go back to Meharry to do at Meharry what he's doing at Howard. I went on from Howard to the University of Pittsburgh, which is the largest transplant center in the world, and trained under Dr. Thomas Starzl, who's a transplant pioneer. And while doing my training in multi-organ transplantation, I began to do a lot of speaking in the black community on the issue of organ donation and transplantation. Decided to come back to Meharry and returned to Meharry in 1992. Was it 92? No, 1994. 1994 when I came back, and had the pleasure of working with Dr. Faulkner, who's been doing excellent work in the organ donation aspects, and so I think that I just wanted to be with her doing these projects. And the team of the nephrologist and the transplant surgeon working together, I think, has been going well and is going to blossom. That issue is very important. As Dr. Faulkner said, we make up half of the waiting list for organs. And one of the things that we haven't been doing as African Americans is donating organs in the same, at the same level. So I want to help further that, just as Dr. Faulkner wants to help further
Dr. Faulkner, I think up front, when you talk about the donation of organs, what do you find to be the major obstacle to that happening in the African American community, just as a question up front here?
Well, the major obstacles that have been found nationally as well as locally, and we did some community work and with questionnaires to the local community, is that there's mistrust of the medical community. The patients just feel that, or the community feels that someone would take their organs without them actually being brain dead. And so they don't trust doctors when they come into the emergency rooms and say, well, you know, your family member's brain dead, would you like to donate? They don't think that they have enough information at that time. So mistrust is one of the medical community. Number two is that they think there may be some disfigurement of the bodies when when the funeral comes around, and they ask morticians and other people in the community, should they donate? How would things be with the burial? And some people don't know, and so they'll say, well, no, I wouldn't do that. So they figure disfigurement will be one thing. Then another thing is that they feel that the organ should go to another black person. They think that if the organ is taken, or they give the organs, that they'll go to a white person. So there's some racism involved in organ donation as well. And Dr. Stevenson can elaborate on others because he's in that area as well.
Very good. Dr. Stevenson, we'll have a break coming up and we'll interrupt you, but go on and give us some information.
Yes, sir. Well, one of the main reasons is lack of education about the issue. All the reasons that Dr. Faulkner has elaborated on so far are very important, and one of the things that I think is also very important is that there is the lack of education about the issue. So that's why Dr. Faulkner, myself, Dr. Callender, his group, we want to make this thing a national effort to try to increase the awareness about organ donation in the African American community.
And how do you find that that African American donations compare with others, Dr. Faulkner?
African American donations are low. We were 3.5% about 10 years ago, 10, 15 years ago, when Dr. Callender was first approached about the low organ donation rate of minorities. Now we're up to 12, 13%, which is still low because we're about 33% of the dialysis population overall. And we are still about over 50% of the transplant waiting list in many areas. So still that donation is very low, and we're trying to get it up to a higher number so we can get more of us off of dialysis.
Very good. And when we come back, Dr. Stevenson, we're going to have you to talk about some of the problems associated with that. We'll be back with you following this commercial break.